Hello and welcome to the maternity services at the Tunbridge Wells Hospital. My name is Gillian Duffy and I'm Head of Midwifery. Every year about 5,500 women use our maternity services, and the Maidstone and Tunbridge Wells NH Trust is delighted to be able to offer the full spectrum of choices for places for women to birth. The staff working within the maternity unit are absolutely committed to making sure that every woman, baby and her family have the best possible experience.
Hello, I'm Lynn. We're now going to take you on a tour of our maternity unit, showing you how to access the building and what some of the birth rooms look like. When you feel you're in established labour, usually this will be when contractions are around 5 minutes apart and lasting a minute, we would advise you to ring the midwife in the antenatal unit to discuss when is the right time to come into hospital. The midwife will guide you whether to come in straight away or whether you can safely stay at home for longer and phone again later. On arrival at the hospital, you will see a sign for the Women's and Children's Emergency Drop-Off, which is open for 24 hours a day. There are a couple of emergency parking spaces if your labour is progressing very quickly, but otherwise please find a space for your car in the normal parking area. During daytime hours, the door will be open, but out of hours, simply press the intercom buzzer for the antenatal suite to speak to staff so that they can release the door to let you in. Follow the corridor and you will see the green zone signs. These indicate the maternity wards and departments. You will now see 2 lifts. Take lift A to the 2nd floor where the antenatal unit and the triage department are located. On exiting the lift, look for the green signs indicating the antenatal unit. Turn right, through the double doors and keep following the signs. Follow the corridor around to the right, then take the second set of doors on your left to enter the triage area. Here you will be assessed. You will either be transferred to the delivery suite, which is just along the corridor, or sometimes you will be advised to go home if the labour is still at an early stage. We are now heading towards the delivery suite, where we have a team of midwives and doctors who work together to provide high standards of care. We offer a full range of facilities, including birth rooms that are spacious and comfortable, each with their own ensuite. We aim to provide one-to-one midwifery care in labour so that you feel well supported. We also have 2 operating theatres and a neonatal intensive care baby unit in case problems arise. Here, Karen is explaining the advantages of using the birth pool in labour. Research shows that water is really helpful for coping with contractions and for labour to progress well. The water gives a feeling of weightlessness so that you can move around easily, and also it helps you to stay relaxed and calm. Some women like to stay in water for the birth, and others prefer to be on dry land. The main thing is that you explore what is helpful and what works best for you. Birth balls, mats and beanbags help to promote good positions and are available in most of the rooms. Labour progresses better if women are upright and mobile, as it enables them to cope better with contractions and helps the baby to come down through the birth canal. Throughout the labour, the midwife will check the baby's heartbeat regularly with a handheld device, or sometimes with a small ear trumpet. Karen also shows Sally the gas and air, or Entonox, which is available in all the birth rooms. This can help with the more intense contractions later in labour. Where possible, we have concealed equipment in the cupboards so that it is available if needed. This means that the room is not cluttered with equipment and has a welcoming atmosphere. Karen demonstrates the resuscitaire. One is available in each birth room in case the baby needs a little bit of help when it is born.
Hello, my name's Hannah Baxter-Smith and this is Finley. He's 2 weeks old. And we came to Pembury to have a water birth. I had a lovely experience. Both the staff and the facilities here were fantastic.
The remaining rooms on the delivery suite are intended for women who've had less straightforward pregnancies or are possibly having their labours induced. These rooms have a little more equipment around, but again we try to store this out of the way behind a curtain unless it is needed. Equipment that you may see in these rooms includes a baby's heartbeat monitor and a pump to give drugs to speed up a labour or to give epidural pain relief. Sometimes it is advisable to have the baby's heartbeat monitored continuously to check all is well, and this is done by fitting 2 belts around the mother's tummy, which are then connected to the monitor. If this becomes necessary for you, remember that you do not have to be lying on a bed to be monitored, and being in an upright position will help you to labour and to give birth. If you really do need to use the bed, it is worth knowing that it can also be adapted in a number of ways so that you can get into a good position. Leaning forward in labour is a good way to help you to progress in labour, and a number of women find this helpful. When you come into hospital, your midwife will help you to explore what works best for you.
Hello, my name is Mazena, and this is my little boy Henry. He was 3 weeks old yesterday. He was born here on the 27th of May. We had a bit complicated delivery. It was ventouse, but the overall experience was fantastic here. We had to stay in hospital for a few nights, but everyone, all members of staff were very helpful. Everyone went out of their way to help me and him, and overall experience was fantastic.
At the birth, the baby is usually dried and lifted onto your tummy, which helps the baby's breathing to regulate, helps initiate breastfeeding, and begins that very special relationship between mum and baby. We also will be encouraging you to have regular skin-to-skin contact for the next few days for the same reasons. You don't need any special equipment to do this. However, some mothers find the Kangaroo app can be very helpful. We actively promote and support breastfeeding as there are such huge benefits for mum and baby, but will of course support you in whatever feeding choices you make. The postnatal ward is on level 3 of the Women and Children's Department. It has 31 single rooms, all of which are en suite, and a sitting room where you can meet with new parents. Most mothers will transfer to the postnatal ward within a few hours after the birth of their baby, although some go home directly from the delivery suite, especially if they already have children and are keen to get home. Most women stay for 1 night, although we usually advise 2 nights if you've had a caesarean birth, and occasionally some women may need to stay for longer if they have medical concerns. Your partner and your children are welcome to visit any time in the day. However, we restrict visiting for others to minimise infection risks and also to ensure that you get some time to rest. Please see the maternity website for visiting times and details. Partners may stay overnight to give help and support. However, the facilities we are able to provide are limited. We are unable to provide a bed, and access to and exit from the ward is restricted after 10 p.m. When you go home, we will inform your community midwife and she will visit you the next day. If you live outside our area, we will contact your local hospital and inform them of your discharge. We hope you've enjoyed the tour and found it really useful. If you have any further questions, please contact us or speak to your community midwife who will be able to answer any questions. And we look forward to seeing you soon.